Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider. Paracentesis, Abdominal Tap. Introduction. An abdominal tap is a procedure where a needle is inserted to remove fluid from the abdomen. It is also called paracentesis. If your doctor has asked you to have a paracentesis, this patient education tutorial will help you understand the procedure. It discusses what could happen before, during, and after the procedure, as well as the benefits and risks. The abdomen. The stomach and intestines are located in the abdomen or belly. The liver, pancreas, spleen, kidneys, bladder, and big blood vessels and nerves are also inside the belly. In women, the uterus and ovaries are located in the lower part of the belly, or the pelvis. The organs and tissues of the abdomen are protected by a layer of muscles and the skin. The peritoneum is the inner lining of the abdomen. It's a silk-like membrane that covers the organs and the abdomen. There is normally a little fluid in the abdomen. However, some medical conditions cause large amounts of fluid to build up in the abdomen, which may cause pain and discomfort. When too much fluid builds up in the abdomen, it's called ascites. Ascites can be caused by infection, severe liver damage called cirrhosis of the liver, cancer of the ovaries, cancer that has spread to the abdomen from another area called metastatic cancer, trauma or severe injury. Indications. Paracentesis or abdominal tap is a medical procedure to remove fluid from the abdomen using a needle. It is also a test to find out more information about the fluid. Doctors order an abdominal tap for the following reasons: to diagnose the cause of fluid accumulation, to check if the fluid is infected, to check if the fluid has cancer cells in it, to relieve pain and discomfort caused by extra fluid. After taking the fluid out, the doctor sends it to a lab. In the lab, tests will help the doctors find out why the extra fluid was building up or to check for infection or cancer cells. Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials. Preparation. There are no special instructions to prepare for paracentesis. Female patients need to let their doctor know if they may be pregnant. You need to tell your doctor or healthcare provider if you are taking any medications, including blood thinners, you have bleeding conditions, you're allergic to certain medications or substances. Procedure. Paracentesis or abdominal tap is usually done under local anesthesia. It can be done at the hospital or in a doctor's office. It is an outpatient procedure, which means you can go home after it is done. You will be asked to lie on your back. If needed, the abdomen is shaved before it is cleaned. The area where the needle will be placed is numbed with local anesthetic. You may feel a stinging sensation as the numbing medication is injected. The big needle with a plastic sheath used for paracentesis is then inserted through the skin and the muscles into the abdominal cavity. As the needle is inserted, you may feel some pressure. Once the fluid starts coming out, the needle is taken out and the plastic sheath is kept in place until enough fluid has been removed. Next, the catheter is taken out and a Band-Aid placed at the puncture site. In rare cases, the healthcare provider may need to use an ultrasound or a CAT scan to help locate the fluid. These will show an image of the inside of the abdomen. The fluid is sent to the lab for diagnosis. You will hear from your doctor when the results are in. If you do not hear from your doctor in a few days, make sure to contact her or him to get the results. Just because you may not hear from your physician does not mean that no news is good news. Risks and complications. Abdominal tap is a very safe procedure. However, like any invasive procedure, it may cause bleeding or infection. This is rare though. In rare cases, the needle may cause injury to abdominal structures such as the stomach, intestines, bladder, or blood vessels in the abdomen. If an injury like this happened, surgery might be needed to stop the bleeding or injury. After the procedure. If the extra fluid was causing pain and discomfort, an abdominal tap may provide immediate relief. If a large amount of fluid is withdrawn from your abdomen, you may feel dizzy. Tell your healthcare provider if you feel dizzy. After you go home, you should contact your doctor if you have severe abdominal pain, fever, drainage or redness and tenderness at the site of the needle stick, fluid build back up in your abdomen again. Don't forget to check back with your doctor to get the results of the test. He or she can help you understand what they mean, too. If you like this video, please like and share. For similar videos, subscribe to our channel. Conclusion. Paracentesis is a procedure in which a needle is inserted to remove fluid from the abdomen. It is also known as an abdominal tap. Doctors order an abdominal tap for the following reasons: to diagnose the cause of fluid buildup, to check if the fluid is infected, to relieve pain and discomfort caused by extra fluid in the abdomen. Paracentesis is an outpatient procedure done under local anesthesia. It can be done at the hospital or the doctor's office. Paracentesis is a very safe procedure. Risks and complications are very rare. Knowing about them will help you detect them early if they happen. The fluid removed from your abdomen is sent to the lab for diagnosis. You will hear from your doctor when the results are in. If not, call to check for the results. Thank you for using Explain.